Hi friends, Dr. Tim Garcia coming to you from my chiropractic wellness center here in Ventura County. And today I'd like to talk a little bit about breastfeeding. Now maybe you're wondering, what does a chiropractor have to do with breastfeeding? And the answer is that, number one, I am in the health field profession, and I could talk to and speak to various alternative issues, but mainly because when children are born, there could be a traumatic birth trauma to the spine, especially the upper cervical, the first vertebrae, that's so close to the brain that it could disrupt the sensitive nervous tissue and nervous impulses, so the baby won't know or learn proper natural responses to latch on, to take nutrients. And as you know, the infant is so young and neurologically immature that chiropractic will help the baby learn and do some of his daily functions, daily activities. And that's why it's important to be checked by a chiropractor. Some of my practice is geared towards pediatrics. But a little bit of information on breastfeeding. Perhaps you know some of this stuff, perhaps you don't. But when you're an expectant mother, lots of things to consider, lots of things to think about, maybe from car seats to diapers, or whether you're going to breastfeed or not, and if so, for how long. So here's some information. Every year there's more scientific evidence pointing to the things we already know, namely that a mother's milk is the best food for her baby. And there was a study in 2005 from the American Academy of Pediatrics aggressively urging mothers to breastfeed for at least a year or for as long as mutually desired. And this is what people have basically known over time, but only a mother's milk supplies the nutrients necessary for a baby's physical and mental development, with the added benefit of a natural immunity against diseases. There's some abundant benefits for the child, like fewer incidents of ear infections, cold and upper respiratory tract infections, decreased allergies and asthma, diarrhea and gastrointestinal diseases, childhood lymphoma, and sudden infant death syndrome. So the facts are in. The breastfed child has a stronger immune system, leading to an overall healthier and happier child. But the benefits are not only limited to the child. Mother has benefits in the following: decreased risk of breast cancer, easier recovery from delivery, and financial savings from not buying formula or not visiting the medical doctor you'll have a healthier child. And excuse me, the American Journal of Clinical Nutrition showed that breastfed infants scored 3.1 to 5.2 IQ points higher than formula-fed infants, based on a study involving 11 different studies and 7,000 children. So although it's uncommon in the United States, the world average for nursing is 4.2 years. The World Health Organization advises breastfeeding until at least 2 years of age, and then continue nursing for as long as the mother and child want. This is a bridge version, a short version of this lecture I give. If you'd like more information and to see the whole slide presentation, we could obviously do that for you in our office, or we can do that for your group. But this is Dr. Tim Garcia coming to you from my wellness center to show you more strategies and tips on living a healthy life and staying well, and health is your wealth. And if you have any questions, please don't hesitate to call our office. Thanks.